our own research, the stress that can be caused by things that were in the holiday season. Although this year may be a little bit odd because of the pandemic, but in traditional times, travel, social gathering, all the shopping and all of that, right? So what we kind of want to do is explore this a little bit further and confirm some of our research. We have 6 questions for you, and if you're okay, then I'm going to start with those. I also wanted to ask, do you mind if I record? It's for internal purposes, just so I can
No problem.
Okay, perfect. Thanks so much. Okay, so the first question that I have here is, so what happens to arthritis patients when they experience flare-ups?
So arthritis is typically it's not a static disease. It is an episodic, ever-changing, dynamic, and progressive disease, again, characterized by, eventual breakdown of the joint, but it's not, how would I say it? Like you said, it's kind of the accumulation of episodic events which leads to the breakdown of the joint. And a flare-up is basically when we see an increased amount of irritation to the joint, which is caused by both swelling and thickening of the joint, stiffness of the joint, and from what most people feel would be pain. And so these flare-ups are what often bring people to the doctor. Look, when a lot of people know they have arthritis, but it's the flare-ups which are the things that become disabling. And so that's usually when someone will seek medical care.
Got it. And usually how long do these episodes last? I mean, I'm sure there's a variation, but what would
what we see is anywhere between 2 weeks to 2 to 3 months is the usual.
Okay, great. And what are the most common reasons for arthritis flare-ups?
It can be an injury, like a subtle injury, a small injury, a large injury, sometimes a misstep. Sometimes there can be inflammatory triggers in someone's life based on their diet, life stresses, and then what else? Those are probably the most common.
Okay, the top one's great. So the way that we envision going out with this pitch is really kind of providing like a listicle, where we can provide reporters with what are like the top ways that arthritis patients can minimize their risk of flare-ups. So would you be able to give us a little bit more of information of like maybe 2, 3, 4 things that arthritis patients could do?
Yeah, so the mainstay is because there is no cure for arthritis. The mainstay of treatment is the prevention of flare-ups. You're spot on. You got it right. And so when we spend our time discussing with patients, it's to minimize those flare-ups and the triggers. And so for us, the most important, again, are going to be maintaining your weight. And the reason for that is we know that increased weight also produces more inflammatory triggers or cytokines in the body. And so we know that people who keep their weight under control will have less inflammation in their body. So weight loss and then diet, obviously certain foods are going to trigger inflammation. So avoiding foods that have a high inflammatory component. So a lot of animal products seem to cause more inflammation in the body. So it's weight, inflammation, and then food, and then the third is going to be basically injury prevention. And injury prevention, so you don't take that misstep, so you don't twist your knee the wrong way. And so injury prevention is done through physical fitness, whether it's visits to a physical therapist, a personal trainer. And then the most important thing is cross-training, not doing the same exercise over and over again, but trying a variety of lower impact stabilization exercises. Is going to be the third, probably actually, and this is not in order, these are just options. And then let's see, can there be a fourth one? No, I would say there's three. So it's weight loss, dietary, and then injury prevention.
Great. And let me ask you, because of course, when we think of the holidays, something that we all do is eat probably things that we
Right.
shouldn't be eating or that we usually don't eat.
Right.
So, is there, and right, I know this is not necessarily the specialty nutrition, but is there certain tips from the food perspective that arthritis patients should be keeping in mind?
There's no good science on this. So, the mainstay would just be, portion control and then substituting some of your animal products for what we call plant-based. So plant-based substitutions for some of our more enjoyable animal products.
That's great. And let me ask you, so we talked about prevention, but when we think of okay, so the patient already had a flare-up, is there ways to treat those flare-ups?
So treatment is going to be either over-the-counter, non-steroidal anti-inflammatories. So we call those NSAIDs.
Mm-hmm.
If you are medically safe to take those, there's a lot of people who cannot take them, so you should check with your doctor, of course. And then we also treat these types of flare-ups. We have a clinic dedicated to basically these types of things called the Arthritis Clinic here at Doctors Hospital. And of course, any orthopedic or sports medicine specialist can also treat this. But sometimes these things might require things like a brace, temporary immobilization, sometimes drainage or injection of the joint, or other more powerful types of medications.
Does age play a role at all with these flare-ups? Do we see trends with certain people, certain age bracket getting flare-ups more often?
Yeah, for sure. Obviously, the age, the age puts you at higher risk of developing arthritis and different types of joint diseases. But it's not the only factor. It can happen at any age, but of course, we do know that the water content in the cartilage changes as we age, and that will put that joint at higher risk for these flare-ups.
Great. And is there any other factor besides age that we should keep in mind? I know we talked about food and all of that.
Weight, definitely.
Yeah.
Weight is going to be one, and obesity is such a problem now that it's becoming probably one of the more preventable causes for arthritis. But people have had pre-existing trauma, pre-existing, I would say, other than age, because unfortunately being female, women are more likely to develop knee arthritis than men, almost twice as likely. So that's not something you can prevent. And then I would say, and then just the main thing is to understand is that joints respond to use, not to rest, and we know that people who are physically more active will feel less joint pain than people who are sedentary. And so it's important not to, obviously after a good evaluation by a provider, it is important to realize that physical activity is really important for the maintenance of your joints and the mitigation of flare-ups.
Absolutely. That's great. Well, thank you so much. These were really the 6 questions that I had, but I kind of want to open it up now and ask if there's anything that you think that is super important for us to include that we may have not talked about, as well as ask John if there's anything that he wants to ask.
Well, if I can, thank you, Doctor. This is John Fernandez. I oversee the blog for Baptist Health Marketing. Obviously, we're in the middle of this pandemic and there's a surge going on. I was wondering, I always look for trends And are you seeing more patients with arthritic flare-up because there's more people like staying at home and not maybe being as active, as physically active?
Yeah, you're seeing it's kind of a mixed. It's a mixed answer because there are some people who are not. We're not seeing the kind of the weekend warrior injuries that we used to,
Right.
because people aren't participating in those types of events. But on the other end, people are becoming much more sedentary now, and so they're not maintaining their bodies, and this is putting them at risk for these arthritic flare-ups. So in fact, you'll see my sports medicine colleagues are often seeing a little bit of a decrease in their demand, and us in the arthritis, degenerative kind of side of things, we're seeing an increase for our surgery.
Interesting.
So this pandemic has probably made people feel worse because they're not taking care of themselves. It's difficult. The gyms are closed. You know, it's been a really hot, miserable summer. I mean, I feel like we're in November. It's still summertime here. So people aren't going for their walks. People aren't enjoying, their lives as much.
Yes, and certainly the rainy season is longer than
I went for a run this morning, and it was like the same weather as it was in July.
I know, it's amazing. And when it comes to, we talked upon fitness, the importance of being active. Is there a distinction between strength training and aerobics or walking more? I mean, which is better for arthritic patients, or a combination?
Yeah. So the recommendation is always lower impact activities.
Right.
So you want to avoid like repetitive high end. You want to avoid things like jogging, for instance.
Mm-hmm.
But we do know that even people who do low impact stuff, just like walking, can get really bad flare-ups, and that's because of the risk of an overuse injury.
Right.
So we don't ever recommend you do just one activity over and over again. We do recommend a combination of, aerobic, some strength training, balance training, and flexibility training. So those are all, we want people to work those into their their physical fitness regimen. You can do that with a variety of different enjoyable activities, sports, yoga, Pilates, body weight, strength training, spinning, elliptical, even weights, and then different sports like tennis, and Tai Chi for our older population, and the list goes on.
Okay. And any links between having arthritis as an issue and COVID? I mean, is there in your practice?
So that hasn't been reported yet. So no links to these arthritic flare-ups with a COVID diagnosis now.
Okay, because I know inflammation is an issue, but with COVID, but
we haven't seen that. We haven't seen arthritis flares
okay.
with the COVID population.
Okay, that's what I figured. All right. Well, thank you very much, doctor.
Yeah.
I think I'm good.
Good question.
Anything
Great.
else?
So
Go ahead.
just gonna finish it up, I guess. So there's nothing that you think that we didn't address today. Just want to make sure that we capture the most important.
The main thing is always if you haven't had it, you should always get a diagnosis before you start treating yourself,
Right.
and that's critical to any medical condition, but no different because not all joint pain is arthritis. It can be different things can cause that, and so that's always recommended. And we don't want people self-treating without knowing what's going on. And they shouldn't be afraid to seek medical care during COVID. The hospital, our healthcare system has done a really good job, with making sure that we have a safe environment. And I will continue to say that I still feel safer in the hospital and at work than I do in the community because of the precautions we take. So. The most thing, is just to try. You guys do best. Try your best to stay active, and be creative with your physical fitness routine. Now that we're out of all of our regular routine.
Wonderful.
Yeah.
Well, thank you so much again. We truly appreciate you taking the time out of a very busy schedule. So we're as next steps, what we're gonna do is.
Okay.
Draft this up. If we have any questions, we'll reach out. And of course, as soon as we start receiving any media traction, we'll keep the entire team updated.
Perfect, awesome, thank you, guys.
Great, thank you.
Thank you, doctor.
Thank you so much, doctor.
Bye, everybody.
Take care.
Take care, bye.
Bye-bye.